Now let's get into the benefits and risks of pacifier use. Many of these we've just discussed, but I wanted them to be outlined very clearly here. Baby is going to receive the most benefits from their pacifier between birth through about 6 months of age. The main reason is pacifiers provide that essential non-nutritive sucking skill which helps soothe and calm baby and helps regulate their sensory system. Sucking on a pacifier can also help keep baby calm and regulated during painful procedures or while they're teething. Pacifiers can help strengthen oral motor skills that are important for eating and speech later on in life, and we'll go over selecting your pacifier in more detail during the next segment, so hang tight. And as we've talked about before, sucking at the onset of sleep helps reduce the risk of SIDS, whether that be sucking at breast, bottle, or pacifier. And again, it is not recommended to replace the pacifier if it has fallen out while sleeping. What about after 6 months? The two main reasons you may want to consider weaning the pacifier around 6 months is 1, there is a higher incidence of recurrent otitis media or ear infections with babies who use a pacifier beyond 6 months, and 2, it is much easier to wean a baby from a pacifier when they're younger. Research shows that pacifier use is a risk factor for recurrent ear infections. However, these studies cannot determine causality. Other risk factors for recurrent ear infections include parental smoking, bottle feeding, mouth breathing, use of daycare, and socioeconomic variables. So then this makes me wonder, does pacifier use actually result in ear infections, or do children with more health issues such as ear infections use a pacifier more often for soothing and comfort? I don't know, but the research does say that pacifier use is a risk factor for recurrent ear infections, so just something to consider. After 12 months, there's essentially no benefit to using a pacifier, and it becomes harder and harder to wean the longer you wait. And I know, as a parent, you're wondering, how the heck am I going to get that pacifier away from my baby? You're probably thinking there's no way, they love that thing, and I'm not suggesting you cut it off cold turkey at 12 months, but I just want to continue to give you some things to think about here. The risks do begin to outweigh the benefits after 1 year of age when we consider how objects in baby's mouth impact the development of their palate or the roof of their mouth and their overall facial development. And I'm not just talking about pacifiers here, really anything that can fill that space, such as bottles, sip cup spouts, fingers, thumbs, can all impact how those structures form and function. The preferred oral resting posture is lips are closed, the tongue rests in the roof of the mouth, keeping it wide and flat. There's a slight space between the teeth known as the dental freeway space, which should be seen, and we want to see nasal breathing occurring, so from the nose, not mouth breathing. So what happens with prolonged pacifier use? And by prolonged, I'm talking about 3 to 4 years and beyond. Pacifiers hold the tongue down to the floor of the mouth and the pacifier centrally to the roof of the mouth, and then there's this continuous light pressure which takes the palate from being flat and wide, which is what we want, to narrow and high. The lower jaw is also open beyond its normal resting position, and the inward pressure from the cheeks during sucking give the face a more elongated shape. So you can see how this would impact nasal breathing, because the roof of your mouth is also the floor of your nasal cavity. So if baby loses space here, then they're going to be forced to open their mouth to breathe. And then what we know about open mouth posture and open mouth breathing is it can lead to sleep disordered breathing, and it's been linked to difficulty trying new foods, ADHD, and learning difficulties as well. If you were to speak with any of our dental friends, they're not only concerned about all of the things I just mentioned, but they are also concerned about how pacifiers impact the bite, or in other words, how the teeth on the top and bottom row of your mouth line up. Having an object there holding the mouth open can cause misalignment, which can impact biting, chewing, and may cause some speech distortions. Some professionals believe that pacifier use has an impact on speech and language development. The rationale behind this belief is, number one, speech sounds are distorted or produced inaccurately from dental malocclusions, and 2, placement of a pacifier reduces the opportunity for a child to babble and to practice accurate sound production. And And although as a speech pathologist, both of these explanations make perfect sense in my brain, the research for pacifier use on speech effects is actually really small and of poor quality. One research article showed a possible connection between speech sound errors in the sounds that form in the front of the mouth and pacifier use, but those resolved as the child got older. So this suggests that for a short period of time at least, there could be some speech sound distortion caused from the pacifier that goes away after pacifier use has been discontinued. And I'm not saying that prolonged pacifier use does not have an impact on speech sound development. All I'm saying is that the research isn't clear right now. I feel like this is a good time to share another personal story. So when my daughter, who was a binky lover, was about 15 to 18 months old, I noticed her speech sounded really distorted and kind of garbled almost, like she had a mouthful of marbles. And I'm really glad I was able to cue into that because at the time I had a 3-year-old and I was pregnant, so I was super relaxed on pacifier use. But once we transitioned to pacifier only at bedtime and then we removed it completely, her speech became a lot more clear and accurate. I'm going to include a picture here of what her mouth looked like at the time as well, because you can see how the pacifier was impacting the shape of her mouth. And then this is what her mouth looks like now. I hope this helped you understand a little bit more about what the research says when it comes to the benefits and potential risks of pacifier use. Because I'm coming to you as both a parent and a professional, I want to take a moment to say again to use the information you're learning here to make the best decisions for your family regarding whether or not you want to even introduce a pacifier, when to introduce the pacifier, and when to start thinking about weaning from the pacifier, which will actually be the final topic in this series. Next, I want to get into why the features of a pacifier matter and which pacifier I personally recommend.